We are going to take you live to Adelaide now, where the South Australian Premier is speaking.
All of these people are in a stable condition. We're not seeing any deterioration there, but the numbers, unfortunately, are escalating, and so this is something that we're keeping a very, very close handle on. We also have previously reported about the situation with the Sobering Up unit at Port Augusta. We've now got the vast majority of all of those tests back, and there are no further positive cases whatsoever. So we're very grateful for that. I think we've dodged a bullet. This is a particularly vulnerable cohort. There was somebody working in that facility for 5 days who was COVID positive. Obviously wasn't shedding that disease particularly strongly, and we've had no positive cases. So we're very pleased about that. In terms of vaccination, unfortunately I've got to report that yesterday was still a very low day in terms of vaccinations for South Australia, although I'm pleased to see that there have been more people turning up in the vaccination clinics today. So I'm very grateful to the media for the work that they are doing in promoting the fact that you can get online, you can book your vaccination, you can book that booster. It's the very best thing you can be doing in South Australia at the moment. It seems that obviously New Year's Day was a low day. Yesterday also, I think people must have been just coming out of that post-New Year's Eve haze, but today we're seeing some more numbers. We really want to see that climb. In the next couple of days we'll be talking about our surging capacity for vaccination and boosters across South Australia. Many people will become due for their boosters right about now, and so we'll be flexing up that capacity. We're looking for all and every single opportunity, new sites, new workforce, trying to do everything we can to get those jabs into the arms of South Australians as quickly as possible. I should also report that there will be a slight change to our direction in South Australia today. Previously, we've talked about the definition of close and casual contacts. So casual contacts no longer require isolation in South Australia. They no longer require testing in South Australia. That's been in place for some time. We're just asking people to monitor their symptoms. But with regards to close contacts, as you know, we've been narrowing that definition down because we're balancing the issues associated with the spread of the disease with the workforce availability in South Australia. I think we've got it about right. We're signed up to the National Cabinet position, which is that household and intimate contacts are automatically designated as close contacts in South Australia. Secondly, we have 2 other areas of exception, one with vulnerable cohorts, for example, aged care, and also Aboriginal communities. These are areas where we're not looking to scale that down, so we made it clear that that was an exception in South Australia. And the other was when there has been a significant transmission at a particular premises, whether that be out in public or whether it be a work premise, and those people will be in those 2 groups directed by the CDCB, the Communicable Diseases Control Branch. We have been asked, though, about this definition of how long you are with somebody and whether that would actually be a close contact, and so we've been asked to clarify that and make it very clear, and that will go into a direction later today. So if you are face-to-face without masks indoors, then you will be designated a close contact if you've been there for more than 15 minutes. So this provides the clarity that I think a lot of people were asking for. It doesn't apply to, for example, if you're in a restaurant, the waiter, if the waiter is wearing a mask, then they wouldn't be designated a close contact. But it's quite clear, if you're out with somebody who is COVID positive, face-to-face without a mask indoors for more than 15 minutes, it's very likely that you are also COVID positive. And people don't want to be doing the wrong thing. They don't want to be going out and spreading this disease to vulnerable people, or going and visiting their grandparents and saying, well, look, I'm not a close contact. So we've been able to provide that. That's effective immediately, but it will be put into a direction later today. And I can also let you know...
OK, some changes there in South Australia with the Premier, Stephen Marshall, giving a COVID and booster update.